Hello, everyone. Welcome to Dr. Shrikanth's Elite OET workshop. My name is Dr. Shrikanth, and I provide individual OET coaching for doctors as well as nurses. So today we'll be discussing a little bit about the OET reading module. All right. So those students who are actually not so familiar with the OET, let me just give you a basic idea of what OET is. So OET stands for Occupational English Test, and it is an English language proficiency test that has been customized for the following 12 different healthcare professionals. You can see there is a long list of healthcare professionals over here. So each healthcare professional will get a separate category of OET question papers. All right. And right now, regarding who owns this OET or who formulates the OET question papers, it is these two organizations. That is the Cambridge English Language Assessment Organization, as well as the Box Hill Institute in Australia. So both these organizations together own the OET examination. And this test is right now conducted in about 35 countries. And with each and every year passing by, the list is keeping on increasing. And you can take the OET exam up to 12 times a year. So once every month. Okay, so that is a little bit basic information about OET. And OET consists of four different subtests or four different modules. So it is very much similar to the IELTS. So let's see what those four different subtests are. So listening module, reading subtest, the writing subtest, as well as the speaking interview. All right, so these are the four different components of OET, and it takes just one day. So it takes one whole day to complete the OET examination. So today, as I mentioned to you before, we'll be just focusing only on the reading section. So regarding reading, I shall give you certain tips, certain strategies, and some basic information so that you can approach the OET reading module with a little bit more confidence and with a little bit more idea, so that we can help you to enhance your OET reading scores. Cool. All right. So section overview of reading. The OET reading test consists of three separate parts. All right. So namely, it is part A, part B, and part C. In total, you can expect 42 questions, and it takes exactly 1 hour to complete. So 60 minutes for 42 questions. So that is how the OET test is formulated. So let's go to the very first part of the OET reading module, which is known as the part A. All right, so let's see what we can expect in part A of the OET. In part A, you have to answer 20 questions. All right, and these questions comes from four different paragraphs or four different texts. And these texts are named as text A, text B, text C, and text D. All right, so this is what you can expect on your question paper booklet of your OET reading part A. And you have 15 minutes to complete these 20 questions of part A on your test day. So even when you're practicing your OET reading at home, before your actual test day, you must always have a timer with you and try to finish those 20 questions within this stipulated 15 minutes of time. All right. So the information is presented in different ways in all the separate paragraphs, and all relate to one specific health condition or one specific type of treatment. All right. So this is how the four texts will be written in your OET question booklet. And another thing to remember is that in OET reading part A, the reading part A specifically comes in a separate question booklet, whereas part B and C of the reading comes in a different question booklet. So once you finish your part A of OET, they will take your question paper booklet along with them, and then they will provide you your question part, part B and C question booklet. So that is how it works. So basically, you get two different question papers for your OET reading. Okay, let's discuss some strategies there, because that is what you really want to hear, right? How you can enhance your score, improve your scores. So on test day, you will not be told which text to find the information in. So you will have 20 questions, right? So they will not actually tell you this one specific question's answer belongs to this specific test. You have to read the question, and then you actually have to find out on your own where the answer is located among all the four texts. All right. So since they do not tell you where specifically the answer is located, the number one strategy is to scan all the four texts to find the relevant information. So scanning means basically just glancing through the four texts identifying the keywords. So that is one specific strategy known as keyword analysis. Teach my students that. So basically you have to just scan all the four texts, identify the keywords, highlight those keywords, and then imprint those keywords into your brain. And then as you're reading the questions, again, you have to scan through all the keywords of the questions. And then once the keywords are like highlighted in both the passages as well as the questions, you can easily find the answer. So that is one strategy. Scan all the four texts initially. Before you scan the text for answers, you must always pay attention to the words that are in the question, because the question is the number one thing that you have to give importance. Because if you waste too much of time reading all the four texts properly and then you come to the questions, you are not going to manage your time efficiently or effectively. Because as I mentioned before, you have exactly 60 minutes for all the three parts, and for part A you have 20 questions and only 15 minutes. So you have to manage your time properly. So this is a time management skill. So if you really want to develop your time management skills, always pay attention to the words in the questions first, and then you kind of scan all the four texts. All right, so if you do this, you can actually find out, as I said you before, if you do the keyword analysis in the questions and then you scan the four texts, you can actually find out where specifically you can find the answer. Okay, so that is one strategy. And for each question, underline the most important words or phrases to find the answers. So there is no need to be shy regarding underlining or circling or scribbling anything you want in your question paper booklet. You can do whatever you want, whatever helps you to get your maximum score. So always utilize the empty spaces in the question paper booklet to the maximum. So this is how you have to approach your part A of the reading. Okay, so basically, if I'm going to summarize once again, scan all the four texts, pay attention to the keywords in the questions, and then try to find out where specifically is the answer located. And then importantly, always highlight the important words or phrases in both the questions as well as the paragraphs to find the correct answers. All right, so strategies of part A continued. Identify the question types. So in part A, there are four different question types that you can possibly be given. So the very first question type is matching question types, followed by short answer question types, followed by sentence completion or fill in the blanks, and then note completion. So these are the four different question types that you can expect on or part A reading. And the first task will always be matching question types. So this is always the first task, and then it will be followed by two of the other three task types that you can see over here. So matching is always compulsory. It will be there. It will be the very first question type that you can expect. And then you will have either a short answer question types or like a note completion or sentence completion question types. All right, so in total, three different question types. So since matching question types are like a mandatory aspect of this part A reading, we really have to approach this matching question types with utmost importance. So since this is the very first task in part A, it will ask you to identify which text contains the following information. So there will be a list of questions in matching question types. And what you have to do is you just have to, identify where specifically this information or that has been given in the question statement is in which paragraph. So that is what you have to identify. So if the answer is so if the specific information of the question is in paragraph B or text B, you will have to highlight in your question paper saying it is in the part B of the text B of the question paper booklet. So this is so you have to identify and locate where exactly the information is. So that is known as matching. You have to match the information in the question to the information in the paragraph. All right, so it's like what we used to do as children when we were like toddlers in schools, like match the information. So that is what to do. And you should always answer these questions first, as they will help you to gain an understanding of the content within each text. So many students, what they actually do is they kind of go to the second section of part A first, and they leave the matching questions towards the end. I'm not saying that you always have to do the matching questions first, but if I were you, I find this strategy much more appealing, The reason is this: once we do the matching questions first, it will actually help you to gain an understanding of the content within each text. So you'll get a little bit more familiarized with the content. And then once you're going to the sentence completion or note completion or short answers, because you're already familiar with the four text, you can easily manage your time and you can find the accurate answer. So if this works for you, always do the matching questions first, and then you go on to the following list of sections. All right. And if this doesn't work for you, because the reason is every individual is different. What works for one student may not necessarily work for the other student. So according to you, just find out what your comfort zone is, what your comfortable strategy is, and accordingly do that. So my advice is this: to always do the matching questions first, because if you do this, you'll get a understanding of the content. You don't have to spend a lot of time because you're already scanning through all the four texts, and then you get familiarized with it. The questions will avoid repeating words and phrases exactly as they appear in the text. So you'll need to understand the meaning of the question. So what does this mean? So these OET people, they're like very clever and cunning. They do not give you the exact words in the questions, exactly as it is written in the paragraph. So what they do is they kind of mix up the words, they interchange the sentences, and they use a lot of synonyms, and they use a lot of different phrases. But essentially the meaning will be the same in both the paragraph as well as the question. Okay. So in order to because of this, many students, what they do is they just read, they just scan through all the four paragraphs, and but they do not grasp the meaning of the content that has been written in the paragraphs, and they actually look for the same specific words that are in the question, and they struggle to find those very same words in the paragraph. So and it is impossible to find because they do not use the same words. They use different phrases, different words, different synonyms. So that is why it is imperative that you find that you understand the meaning of the passages. Okay, that's what you have to do over here. So always understand the meaning of the question, and then do not expect to there to be the same repeating words in both the text as well as the questions. For example, a matching question might ask, which text provides information about identifying delirium in patients? All right. So for example, this is one example question. So which text? So there are four texts, right? So among all those four texts, which specific text does it provide information about identifying delirium? So identifying means what? Like finding out if this patient has the diagnosis known as delirium. All right. To answer these questions, you need to understand the general meaning of the four texts rather than the specific details. So as I mentioned to you before, all the four texts, that is text A, text B, text C, and text D in part A, will be about one specific health condition or about one specific treatment. All right. So all the four texts will be about delirium, but only one text among those four texts will be about identifying delirium in sick people. All right. So that is what you have to do. Identify, like understand the meaning of, understand the concept, the core idea, the core purpose of each text, and then once you read the questions, you can like directly get the correct answer. All right. So that is one strategy that I can give you over here regarding matching questions. Okay. So now let's go to short answer questions. Short answer questions. These questions will often include specific words such as type of medication. That's the first thing. The second thing is treatment type or the reactions in question in the patients, right? So everything is related to healthcare. All right. So unlike matching questions where there is no like specific words, where they just give you an information in general, and all you have to do is like find out where the answer is located. In short answer type of questions, instead of a general meaning or overall section of the paragraphs, you can expect specific words, and those specific words will directly correspond to either medication, treatment, or reactions in people, in patients. So I expect that. And what should patients suffering from, for example, this is one question type: what should patients suffering from fever be given? So as you can see over here, something should be given to patients who are suffering from fever. So what should it be? So obviously it cannot be a treatment. It cannot be a reaction. It has to be a medication. All right. So it could be answered with a type of medication and beverage or an item. So this is what I say in short answer type questions. Expect specific words and specific answers. And you have to just figure out what type of answer it could be. Like, is it a specific medication or a specific beverage or a specific item? So specificity is the idea that you have to understand in short answer type questions, right? And if you're struggling, unfortunately, there are some questions, some may be quite easy to answer, but some it may take some time to get the hang of it. And if you're just struggling to find the answer to the question, um, you know try to figure out what type of answer you need and look for possible answers in the relevant text. So as I mentioned you before, in specific short answer type questions, right, everything is about specificity. So it may be different, and there are like different types of specific answers like medication, treatment, or reaction. So after you read the question, you just you just, and if you're struggling a little bit, just try to figure out what type of answer is down there. So is it a medication or a beverage or an item or a treatment, or what type it is? And then as you're reading so once you figure out, so once you have narrowed down the options, then you can just, and also since you're already a little bit familiar with all the four text after doing the matching questions, then you can easily find the correct answer. All right. So it takes a lot of practice to, to cultivate and develop all these tactics in reading questions. So just by me just telling you a little bit of a theoretical aspects about reading, it is not going to be, you're not going to get the actual hang of it. So you actually have to practice, practice, practice. All right. So the answer will generally require about between 1 to 3 words from the text. All right. So short answer type questions does not mean you have to write the answer in just one word. Sometimes it may take up to 3 words, and these 3 words come from the one of the four texts. So keep your answer short and avoid including unnecessary information. All right. So this is a short answer type questions, not long answer. So obviously, try to confine it between 1 to 3 words. So accordingly, just read the question and then complete the question basically. So if it requires just 2 words, finish it within 2 words. But if it requires 3 words, finish it within 3 words. That's what you have to do. All right. So now let's go to the third question type, sentence completion. In sentence completion, so keyword analysis, right? So I told you before, look at the words in the sentence that are likely to guide you to the information in the text. So this is what I mentioned to you before regarding keyword analysis. So keyword analysis means what? You read the question, you identify the keywords in the question, you highlight them, and then once you have done that, you look at those highlighted keywords in the questions, and then you kind of you just glance back at those 4 different texts and then try to find out where exactly those highlighted keywords match. And once you do that, it will so this is one way of the keyword analysis actually guiding you to the correct information in the text. Okay, so that's the thing. So look for the words in the questions and help and let them guide you to the information in the text. Scan the text for these words until you find the information. So scanning the text means what? So if your question paper is like very neat, if you haven't scribbled anything on it, if you haven't underlined any words, then scanning the entire 4 text will take you a lot of time, and obviously you may need well more than 15 minutes to finish your part A. So this is why I always tell my students, you do the keyword analysis. All right, highlight the words, and then so if you do this, scanning the 4 text becomes much more faster. You can rapidly do that, and then you can rapidly get the correct answer. Identify the word or short phrase that is most likely to complete the sentence. And once you have done this, you just have to identify the correct answer and then complete the sentence that has been given. All right. So the strategy basically over here is keyword analysis. Always make sure that your pencil is on your paper, on your question paper booklet, and this, you're just scribbling something, highlighting something, writing some notes on the question paper booklet. So you really have to focus thoroughly throughout all the 3 parts of your reading. Okay, so let's see how you can improve your score. So first of all, you just have to understand that reading is a race against time. Time is your enemy over here. Or you only have 15 minutes, and on your test day, you will actually feel like this 15 minutes goes like just within 2 minutes. So that's how you actually feel. It goes so fast. So you have only 15 minutes and you have to answer all the 20 questions in part A. So understand that you really have to develop on your time management skills. So while you're practicing at home, make sure that you're really practicing with the timer with you, and trying to complete all those 20 questions within the stipulated time. So you always make sure that you use your time wisely. And by the time you get to the different sets of questions, so by the time you reach the 13th or 15th question, such as so it may be short answer type questions, not completion or incomplete sentences, you should be familiar enough with all the four texts that you can identify the text that the information is likely to appear in just by reading the question. So this is something that I have already discussed with you. You have to once, as soon as you get the matching type questions, you have to scan the questions, scan all the four texts, get familiarized with it, and then when you're moving on to the next few sections of the test, such as short answer type questions and stuff, you really have to understand the concept. Don't just blankly just keep on reading and expecting the reading text to be quite easy for you. Understand the concept of it. So once you're understanding the core meaning of all the four texts, then you'll be like very familiar with all the four different texts. And then when you're releasing so when you have the last 5 minutes or 6 minutes of the part A, you can, just by reading the question, you can identify, okay, this is where the specific answer is. And if you're confident that you identify the information in one of the texts without checking the other text, just move on. Because as I mentioned before, 15 minutes, 20 questions, time is the main enemy over here. So race against the clock. And if you're like 100% certain that this is the correct answer, then without any further ado, just move on. There is no need to like cross check and waste your precious time. Okay, so that is how you have to approach your part A of your reading. I hope that made some sense to you. And now, so once the part A is over, they actually snatch away your question paper booklet, and then they will provide you with your part B question paper. All right. So your question paper part B and C, you'll have 45 minutes to do this. Okay, so 15 minutes for part A and 45 minutes for part B and C. So that makes in total about 60 minutes. Okay, so let me give you an overview regarding the part B of the reading test. So part B of the reading test, it is very similar to part B of the listening test. So so in your test day, the very first test will be the listening, followed by the reading and then writing, and then in the afternoon you will be having the speaking test. So those, I have already done a video regarding the OET listening strategies. So if you're a little bit familiar with the listening test, then you can understand that part B of the reading test is very much similar. So in part B, you will have 6 different extracts. Okay, so basically in listening, you will be listening to 6 different audios. But in reading, instead of an audio, it will be like a text, a paragraph. So in reading part B, you'll read 6 different extracts. Okay, and there's information comes from documents, and it is basically about giving, you can expect the information about giving background information for healthcare professionals and answer one question about each extract. So basically it is about documents giving certain background information for healthcare professionals, not to patients over here, only for healthcare professionals. So it will be like medical terminologies and stuff, and you have to answer one question from each extract. So one extract, one question. So it is a multiple choice questions. You just have to find out which option is the correct answer. So you have in total 45 minutes to complete part B and C of the reading test, and you should allow roughly 10 minutes to complete part B. All right, so this is a rough estimator. So part C anyway is going to be a little bit more challenging compared to part A and part B. So you need to give maximum time for part C. So give about 10 minutes for part B. And that means if you're giving 10 minutes for part B, so that's about you spending on average 1 minute 30 seconds for each question, part B question. And some questions may take less than 1 minute 30 seconds, and some may take more than 1 minute 30 seconds. So you really have to manage your time. So focus, don't let go of your focus and concentration, don't deviate. Always focus on the question paper booklet. Always think about what you're reading through, understand the concept of it. So if you do that, and as I mentioned you before, always highlight the keywords, scribble some notes in the question paper. So if you do all those things, you can not only finish the entire task in the stipulated time, but also not get bored enough. You won't get exhausted. All right, so that is one strategy that I would tell my students over here. So try to finish part B questions within 10 minutes. All right, so and then you have to move on to part C. So let me just give you certain strategies regarding part B of the reading. So part B will be, as I mentioned it before, it will be like generally be made up from extracts from the following text types. So it maybe you can expect the passages to come from notices or emails, manuals, memos, and guidelines. So there is all these information is specifically designed for healthcare professionals. So these are something the healthcare professionals needs to read. So there is no patient conversation or patient symptoms or something like that and all just medical terminology. So this is a little bit advanced compared to part A of the reading module. To answer as many questions in this text correctly as possible, you need to focus your efforts on understanding the main point of the information provided in each of the texts. So the strategy is constant and same for all the three modules. When it comes to reading, you just have to read and understand the main point, the purpose of the text. All right. So luckily in part B of the OET reading module, all the texts are very short. It's not too long, it's not too elaborate. So read the short text, understand the main point of it, understand. All right, and once you understand it, write it in your own words, paraphrase it in your own words, make short notes in your question paper booklet. There is no harm. All right, you can do all those things over there. So strategies: scan the questions. So always prioritize the questions first, or scan the questions, identify the keywords in the questions, and then kind of move on to the passages. So that's not necessary that you have to read all the three or multiple choice options, but read the question first and then understand what the purpose of the question is, and then you understand the purpose of the passage and then try to figure out what the answer is. So unlike the listening test, the OET reading test does not provide additional time to look through the questions before answering them. Okay, so OET listening test is a little bit more lenient. They actually give you certain time to think about. That is, they will actually give you some time to read the question, and then you hear the audio, and then they give you about 5 seconds to mark the correct answer. In OET reading test, there is no leniency such like that. You have they will not provide you any additional time. So within the stipulated time, you actually have to read the questions, read the passages, mark the correct answer. So it's like a marathon race, all right? And you should not falter for one single moment. And even if you do, it's no big harm. You just have to pick yourself up and just strategically move on with confidence. All right. So you should aim to answer 6 questions in roughly 10 minutes. So don't spend too long on any one question. So obviously, like what I mentioned you before, 1 minute 30 seconds as a rough estimate for each question. And if you can't find the correct answer, move on to the next question and come back to this one at the end. So if you're like a perfectionist or if you have like obsessive compulsive disorder, I am very sorry to say that if you are like struggling with one specific question and you're so adamant that unless and until that I find the correct answer to this, I am not going to move on to the next questions, then you're really going to screw up your entire OET reading module. So if you're struggling with the one specific question, you can't find the answer, you just leave it blank right there for the moment. You move on to the next question, find the correct answers to that, and then in the end, you come back and then you kind of choose what, and then you try to find out, if you have time, try to figure out what the correct answer is. And if you're not, you just take a wild guess and just tick the correct option which you think is most likely to be the correct answer. All right, so that is one strategy that I can tell you for part B. So purpose. So always understand the purpose of the questions. So purpose questions require to choose the answer that best explains the point of the text. All right, so basically it's just about the questions. You have to choose the correct answer that corresponds directly to the main context of the text. All right, so you have to like link which is the correct meaningful link to the paragraph. So think about why the text was written. What should healthcare professionals reading the text do as a result of reading it? So obviously the healthcare professionals, they write all these articles and memos and guidelines for one specific reason. And what's that reason? So once they read that, once they grasp that information, they have to use that knowledge for certain good things, right? So what is that good thing that they have to do as a result after reading that specific thing. So that's like you have to think like the reader. Okay, so and also like the person who formulated that very text. All right, so that is one strategy that I can tell you over here. The answer choices will avoid repeating words or phrases from the text. All right, so I already told you this, right? So OET people like very cunning, very shrewd. They will not give you, they don't make it deliberately easy for you to make sure, and they do not make sure that you have the exact same repeating words in the questions, just like as it is in the paragraphs. The meaning will be the same, but the words will be entirely different. So you have to understand the concept of the things as you read on. So as you're doing your practice text, no, just don't read, don't just hope for the correct exact same words, or just don't take wild guesses. Once you're reading, try to understand the very point, very concept of these things. So think, like purpose, such a thing. Why was this text written? Why is it being written? Why is it being given to me to be read by me? So understand the purpose of the text. Understand the purpose, understanding perspective of the author kind of help you to understand the concept a little bit more. As such, it is important to think about the overall meaning of the extract and choose the answer choice that best corresponds to this. So this is basically the same thing that I just mentioned to you before. Once you're reading, just what I discussed right now, overall meaning of the extract. Don't just blankly just read on and just hope your guess is going to be right. Get the grasp the overall meaning of the text. So the purpose, grasp what's the purpose of the extract. The extracts and reading part B are quite short, so give yourself time to read through the entire text. Use the questions to direct your understanding before you consider the answer choices. So since it is a very short, no, so since as I told you before, the part B readings are not elaborate, they are not expanded and huge and massive. They are quite short, precise, concise, and clear. So give yourself time to read through the entire text. Don't leave a single word behind. There you have ample amount of time to finish each task within like 1 minute and 30 seconds. So read through the entire question as well as the entire text, or the extract of part B, and then use the question. So allow the question that comes under the text to help you, to guide you to find what the correct answer choice is. All right, so the question should help you to find the correct answer, should help you to guide what the meaning of the question is, like purpose of what's the purpose of the question, and where exactly you can find the correct answer choice that is located in the paragraph. All right, so that is what you have to do over here. So give yourself enough time. Don't just scan your time over here. Spend your time scanning. All right, so once this is done, then we'll be moving to the very last section of the OET reading module. So this is a little bit challenging. And the reason why it is a little bit challenging is this, that once you actually complete part A reading and complete part B reading, and by the time you actually reach part C, you're absolutely going to be exhausted. You're going to be energy deprived. Your brain is going to be like fatigued, and you are just, uh, you just don't have as much as energy as you did in part A of the reading. So this is the main reason why many students find part C quite challenging. All right, so that's why I always tell my students, always make sure that you have a pencil in your hand and that you're writing something, you're just engaging and interacting with the question paper booklet as much as you can. So when you're doing this, you actually you kind of get energized. Okay, so and you don't you have that adrenaline kick throughout your entire reading module. So that's the thing, do not get don't lose your focus, don't lose your concentration, don't think don't know, are you finishing everything at correct time or how long you have, just don't think, you know what, I'm just so fed up with it, I don't have what it takes. Don't think all those self-defeating irrational thoughts, but rather focus solely on your question paper booklet and then try to find the current answer. All right, so that's the thing. So if you develop the ability to sustain your energy level throughout your entire reading module, then I think I can confidently say that you're going to find the all the three parts of the reading test very easy to approach. So let me give you a basic overview regarding the part C of the reading. So in part C, you can expect two different texts and each text will have 8 questions under each one, under each of the text, right? So earlier in part B, you have one text and one question, all right? And those texts and each text in part B are very short, very concise, but in this part C, it is exactly the opposite. You have like very long text compared to part B, and you have 8 questions under each text. So that's one thing you have to understand. So you have to give like 35 minutes, right? So you have completed about 10 minutes. You allocated 10 minutes for part B. Now you have among in the remaining 45 minutes, you have like 35 minutes remaining, and then uh, you can approach part C here. So the type of text you will encounter will be in the style of articles published for healthcare audience in a healthcare setting. So this is also the reading text comes from certain healthcare articles that has been specifically designed for certain healthcare audiences in a healthcare setting. So all these things will have complicated and complex medical terminologies. So you'll have to be familiar enough with certain medical terminologies and to understand the very concept of it. So a person who is not that much acquainted with the medical terminologies, who is not so much familiar with the current medical system, will find it a little bit challenging. But as a doctor or a nurse or a dentist or a veterinarian or a pharmacist, you can find a little bit easier to tackle the part C questions. So they will not be specifically aimed at any one healthcare profession, and all the terminologies can be easily understood by any healthcare professional. So the listening and reading is actually same for all the 12 different healthcare professionals. Only the writing and speaking is different and customized for each healthcare professional. Okay, so that is one aspect of how the OET exam has been designed. Okay, so you have 8 questions and 8 questions under each of the 2 texts in part C. So strategies of part C. Okay, know the format. Okay, let's see what know the format means. Each question refers to a discrete part of the text, and the questions appear in the order of the information in the text. What does this mean? So this actually means there is one advantage the OET people are giving you over here. And at the same time, it means that each question actually refers to a specific part of the text. Okay, and the questions are formulated in such a way that it goes in a sequential order. Okay, so for example, the first question will be in the very first paragraph, and the second question will be just beneath it, and the third will be beneath it. So unlike IELTS, the questions are not interchanged when it comes to how the order of the questions are written. So that's one thing. So for example, if the second question comes in the second paragraph, then there is no need for you to read the first paragraph again when you're doing the third and fourth question. So it goes in a sequential order. So understanding that will kind of help you to manage your time a little bit more effectively. And the questions will also direct you to which part of the text the question is coming from. So they will actually, sometimes they may be even more kind, and they will be telling you that in the third paragraph or in the fifth paragraph, in the fourth paragraph. So in the question itself, they'll tell you where exactly the answer is located. So you just have to like read that specific paragraph. So that's one strategy. That's not a strategy, but a beneficial thing about the OET. So there is no need for you to skim through the entire text to refine the information. So this is what you have to do in part A. In part A, there is no specific sequential order. You actually kind of have to scan through the entire 4 text to find out where exactly the answer is located. But in part C, fortunately, there is no need to do that. So just read exactly that specific paragraph where the answer is located. And in addition, once you've answered a question about one part of the text, you'll not there is no need for it to look at the previous information. All right, so something that I already mentioned. All right, so let's see certain more strategies regarding part C. The first thing you should do when tackling a part C text is to quickly look through the text. Second, to understand how the text is organized, and 3, what's about. So basically, it's about, again, keyword analysis, scan through all the through the entire text, understand how the text has been organized, how it is meaningfully linked, what is the purpose and what's the reason it's been written. So understand the perspective of the author basically. And as you skim, so skimming is like very similar to scanning, right? So skimming is like you just glancing through the text a little bit quicker. So you might find it difficult to make a few brief notes about the main idea or topic of each paragraph to help you to remember what the text discusses. So skimming, so if those students who do not know the difference between skimming and scanning, so scanning basically means you actually scan through the entire four text, that is not the four text, through the entire paragraph, that is entire text, that is from the very first word to the very last word. You're just glancing through without skipping. So in scanning, there is no skipping of specific portions of the text that has been given. But when it comes to a strategy known as skimming, skimming means where you just intuitively know that you can skip this part of the text. All right, so that is, for example, if there are like 5 paragraphs, and in scanning means you're actually glancing through the entire 5 paragraphs. But when it comes to skimming means you're actually reading the first 2 paragraphs, and then you're skipping. You're not even looking through the third and fourth paragraph, and then you're directly jumping to the fifth paragraph. So that skipping is known as skimming. All right, and if you're employing this skimming strategy, you can find it helpful to make certain brief notes. All right, so since you're not wasting too much time reading through the unnecessary information, because obviously it is in a sequential order, you can just make some, as I told you before, no? Just scribble some brief notes, your own understanding or your own paraphrasing of the main idea of what you just read, to help you to remember what the text discusses. So all these strategies, no, these are not to help you to get the correct answer. All these strategies, like making brief notes, is help you to manage your time more effectively. So once you do all these brief notes and writing here and there, it will help you to remember what the text discusses, so you don't have to waste a little bit more time to once again go and read and then grasp the idea, because time. So most of the strategies in reading part of the in reading module of the OET is designed in such a way to help you to manage your time more efficiently and effectively. All right. So mark any answer options that definitely do not answer the question with a cross. So if you are like very certain, so that this specific answer option is absolutely not the correct answer, you just cross it over there. And then once you find out the very correct answer, then you can like circle it and shade it. And if you're stuck between two answer choices, all right, so this is like doing a 50-50 toss, right? So if you're like stuck between two answer choices, what you have to do is like basically just take a wild guess and move on, because again, time is the enemy. And if you have like lots of other questions to answer and you're not really sure, and there are like two possible correct answers, then you just read through the information again in the question, read it through the in the text once again, and then take a wild guess and just hope that that's the correct answer and move on. So there are no negative markings in OET. So even if you do make a wrong answer choice questions, unlike the PTE, so the PTE exam is like the Pearson's test of English, there is no negative marking. So you can like very much confidently just choose the correct answer and move on. The strategies in part C of the reading test can be broadly divided into 3 different question types. All right, so if you remember my listening video, in part B of the listening, there are like 7 different question types. So when it comes to your part C question types, there are like basically 3 different types of questions that you can expect. The first question type is known as the detail or attitude, and detail, attitude, and opinion type question types. And second is vocabulary question types, and the third one is reference question types. All right, I know that all these things sounds quite complicated and complex, but once you get the hang of it, it's much more easier to understand what they are. So the very first one that we are about to discuss is known as the detail, attitude, and opinion question types. So all these questions will actually ask you to identify information from a specific section of the text, and will most often focus on the views and opinions of the writer. That is, you actually have to once again think like the person who wrote the text. That is, what is, you have to like think from the very perspective of the author of the medical text that has been presented to you. All right, so once you do that, it's going to be a little bit more easier for you to approach these questions. So these questions are the most common questions in type C. So understand this, in part C of the questions, part C questions of the reading module, detail, attitude, and opinion type questions are the most common. So let's see certain examples of these questions. What point does the writer make in the third paragraph? All right, so this is the thing. So the writer is making a point in the third paragraph. So what's that point? So basically, he has an opinion, right? He has a specific detail and he has a specific perspective according to as an author that he is. So what is his opinion? What is he actually what does he actually want to convey, the point that he actually wants to convey. So as you're reading it, so this is how you actually have to do your keyword analysis as well. So you once you read the question, you kind of have to like highlight what the keywords are. So what point is actually a keyword the writer make in the third paragraph. So what point? So in the third paragraph, you actually have to ask yourself, all right, in the third paragraph, the author is actually making a point. So what is that point? So he actually wants to convey us a specific information. So what is that specific information? So understand the very the very purpose of the question, and then as you're reading through the text, look for that point that the author really wants to convey to the reader. And then once you do that, you can like easily find out what the answer is. So that it involves a lot of like inner dialogue with yourself. So as you read, as you're doing the listening as well as you're doing the reading, it requires a lot of inner conversations with you. You actually have to ask yourself certain questions and then move on. So that's the thing. So if you're all doing all these strategies, you will actually find the reading module to be quite interesting. And so many students say it is quite boring, but no, if you do all these certain strategies, as I mentioned before, you find it much more interesting, and then you won't get ever tired. And let's see another question type. In the fourth paragraph, the writer says that conventional treatments can be problematic because. So once again, how do we do the keyword analysis? You see the question, you identify the keywords, and you highlight the keywords. So fourth paragraph is a keyword. The writer says that conventional treatments is a keyword, highlight them, can be problematic. So problematic is also a keyword because. So I have, instead of problematic, I have highlighted because. The reason is this. Because means what? There is a reason. All right. So in the fourth paragraph, because of a reason, all right, the writer says that conventional treatments is problematic. So what is that reason? What is that one specific reason that makes the writer believe that conventional treatments is problematic? And this answer is located in the fourth paragraph. So this is the thing. So you read the question, you identify the keywords, you highlight the keywords, you understand the context of the question, and you ask yourself this: what is that specific reason that the writer believes to be problematic when it comes to conventional treatments? And then you have to say, all right, fine, I'm going to find the reason to this. And then since when you, after you have asked yourself that question, and then you move to the fourth paragraph, then you can, as you're reading through it, you must look for this. Okay, what is the reason that the writer believes so and so? And then as you read through it, you'll actually find the correct answer option, and then you can just mark it. All right, so that is how you have to do your strategies in part C. Okay, so let's move to the second question type, vocabulary question types. So vocabulary questions will present you with a single word or phrase that will be underlined and formatted in bold in the question and the text. All right, so as you can see, certain questions over here, example questions. So it has been highlighted in like bold over here. So I did not do this. It is already like this in the questions, right? So it will be like a single word or phrase. So in all these three questions, it is three phrases that has been underlined and formatted in bold. So to answer these questions correctly, you need to look at the surrounding words and deduce the meaning added by the word or phrase. So what does these idioms? So these words, like you can actually call them idioms you want. So what does these phrases or idioms actually mean? Or what is the message that this specific phrase wants to convey us? So the writer, again, so you have to like think what is the perspective of the writer, right? So the writer uses the phrase cut corners to enforce the idea that. So if you get this question, highlight the word cut corners to reinforce the idea. So there is one idea that is already there, and the word cut corners actually adds a little bit more punch to it. So this cut corners is actually reinforcing the idea. All right, so what is that? The writer uses the word cut corners to reinforce the idea that. And what is that, this specific phrase reinforcing? All right. So reinforcing means what is it emphasizing on? All right. So that's that emphasizing on is something that you have to find out. So once again, like this, you have to have that inner dialogue with yourself throughout. Right? And it's not necessary that you have to like talk in English only. And if whatever your native language is, you can just talk, have that inner dialogue with yourself in a native language. All right. So you can do that, and that will kind of help you to find the correct answer. So in the final paragraph, the writer uses the phrase in the loop to underline. So in the final paragraph, the writer is using this specific phrase in the loop to underline. So again, this phrase is actually trying to emphasize on one specific detail. So what is that specific emphasis all about? So that's what you have to figure out. So ask yourself, all right, what is this phrase actually emphasizing on? And you can ask yourself either in English, if it is in English, all the more better, or if you're like struggling a little bit in the reading section, then maybe you can like, to make it more interesting, you can like talk to yourself in your native language if it helps. As I told you before, like every student is different, right? So if it helps to you, then you can employ that strategy, and then kind of enforce this or implement this strategy in your reading. And I'll just read through the third question type. What is suggested about the attitude toward the trial by the use of the phrase on the fence? So there is one suggestion. So you have to understand this. The suggestion is the keyword here. So what is the suggestion about the attitude towards the trial by the use? All right. So there is one attitude of certain people regarding the trial of something. And regarding this attitude, there is one suggestion. All right. Something has been suggested. And this is the phrase over here. So you have to like ask yourself, all right, fine. So now that I have read the question, now as I'm going to read the paragraph, or I have to just find out what is that specific suggestion over here. And this suggestion is about this specific attitude towards this trial. All right. So ask yourself these questions, and then as you read through the text, you'll like easily find the answer. Now, the third question type in part C is reference questions. Okay, so let's see what reference questions are. So reference questions will ask you to decide what the word or phrase underlined and in bold in the question in the text relates to. So what is actually referencing to? So it is self-explanatory as it is written in the question itself, like reference questions. What does it refer to? To answer these questions, you might need to help. You might need to be able to keep track of what is being discussed in long sections of the text with complex sentences. So you have to keep track of the entire text. You should not deviate through deviate yourself from one part of the text to another part of the text. All right, so let's see what certain examples are. In the second paragraph, what does the word it refer to? All right, so over here is a preposition. So you can expect like prepositions and articles over here, like it, they, because of this and stuff. So what does the word they refer to? The phrase because of this refer to? All right, so obviously when we're using preposition articles, it will be obviously like you're just discussing that has already been discussed. So when the word it means we are actually the word it actually comes after that specifically that specific thing has already been discussed. So this information precedes the word it in the paragraph. All right, and likewise the word they as well. So even the word they actually comes in the specific paragraph, the information or the reference actually precedes it. It comes before it. All right. So before the word they comes, you actually kind of have to figure out what exactly it is, and then find out what exactly they or it means. Again, because of this refers to. So it requires a lot of common sense, basically, and a lot of inner dialogue, a lot of certain, whatever works for you. Like every individual has like their own personalized customized strategy. So you just have to figure out what they are, what your comfort zone is, and then make sure it helps you. All right, so that is about the part, the reading module of the OET. So we have finished the part A, part B, and part C. So as I mentioned you before, my name is Dr. Shrikanth, and I'm an expert OET trainer, and I have my own academy known as Dr. Shrikanth's Elite OET Workshop. And right now I have about 44 OET reading study materials. So I'll be providing all my students with those authentic OET reading materials. And also not only that, I provide individual coaching for OET for OET candidates, let it be nurses or doctors, and I provide personalized listening guidance. So as I told you before, like every student is different, every individual is like unique. So I understand the uniqueness in my students, and accordingly to those uniqueness, I actually customize my reading training to them. So when it comes to reading, I told you before, like we need a lot of skill sets. You need to have skills such as keyword analyzing skills. You need to have time management skills, grasping skills, concentration and focusing skills. And I actually have a lot of strategies, a lot of ideas on how to develop those skill sets. So if you're enrolling into my academy, I can help you out how to develop all those skill sets so that you can, absolutely crack the reading module with effortless ease. All right. So another feature about my academy is that I provide 1 month OET course as well as a 2 month OET course. And if you're enrolling to the 2 month OET course, you'll be given 7 mock tests as well. And or in the case of 1 month OET course, you'll be receiving about 3 mock tests. So I conduct all my mock tests quite professionally. It will be like exactly how it will be on a test day regarding all the 4 modules, right? And it is all individual. So regardless if you choose the 2 month course or the 1 month course, you'll be getting a theoretical orientation on all the 4 OET modules in the very first week of the training. And then it will be followed by extensive practical sessions covering all the 4 OET modules from the second week of training. So that is how I have designed my classes to be. So all my classes are like very much result oriented. I do not coax or canvas my students. I only care about my students result. And it's everything is result oriented. And I have, like, since 2019 I have been in this field teaching students, and because of my specific strategies, all my students have like really benefited to me, and the results of my students speak for myself. All right. So regarding the class timings, it is an Indian Standard Time. Actually, it is. I understand that doctors and nurses are like working people. So if they cannot strictly adhere to one specific time slot, I do try my best to make it flexible for them. So it involves a little bit of cooperation from both the student as well as a teacher, me being myself. So basically, these are the class timings. So it lasts about between 1 hour to 2 hours. So it is between 1 hour sessions. So since it is like individual sessions, 1 hour is more than enough to cover all the 4 OET modules efficiently. And listening and reading and writing is something that I tell my students to do it at home. So in my classes, I only focus, I prioritize speaking and writing mainly, and listening and reading. I provide them customized and personalized guidance. So that is how it is done. So it is like a very neatly designed course schedule. So these are the class timings: 11 to 12, 11 a.m. to 12 p.m., 1 to 2, 3 to 4, 5 to 6, and 7 to 8. And I also do provide like free demo classes. So if you're interested to join my academy, like I do provide free demo classes, and these are the class days. Like A1 batch, the classes are conducted on like alternative days. So Mondays, Wednesdays, and Fridays. So if you are belonging to the A1 batch, and for A2 batch, it is Tuesdays, Thursdays, and Saturdays, right? All right. So I'll just type in my website over here. So this is my website. So if you want to enroll into my academy, you can just log into my website, and you can book your free demo session. All right, so you can book your free demo session at my website, and also you'll be getting a lot more information in my website. So kindly do log into it. So yeah. All right, guys. So that's the thing. I think that we can just call it a wrap. So uh, if you held on to the entire end of the OET reading module discussion, I thank you from the bottom of my heart. So right now I have an introductory offer as well. So those students who are willing to join, kindly notify me through my email. You'll be getting a lot of my what do you call it, the contact details over there. All right. So yeah, thank you guys. Have a good day. I hope this session has been beneficial for you. Thank you so much.